So good morning, everyone. Welcome to this last, at the moment, industry Q&A clinic for post-authorization procedures in IRIS. My name is Caterina Scarpati. I'm part of the change management team for the transition of the regulatory procedures to IRIS. And I have with me today Simona Griniene, who is subject matter expert for this transition, and she will be here to answer your questions on this transition for the next hour. So before we start, just some housekeeping rules. First of all, note that the session is being recorded and the recording will be made available on YouTube. During the session, you will be able to ask your questions via the audience interaction tool Slido. Of course, the interaction with Slido is voluntary, and you may opt to remain anonymous. If you choose to use Slido, you consent to the processing of your personal data, as explained in the EMA data privacy statement for Slido. So let's start. As I said, you will use the interaction tool Slido to send your questions. So you can join either going at slido.com and including the code that you see in this slide, so QA-IRIS. Otherwise, you can also just scan the QR code you see in this slide. Once you get to Slido, you can send your question or look at the questions that were already included by other participants and upvote the questions you would like to get answered by just clicking on the like button next to the specific question. We will answer the questions in order or upvote, so the most upvoted ones will get answered sooner. And I will share the screen and show the questions, and Simona will respond live. While you join Slido and start entering your questions, just a recap of the session scope. So this session is to respond to your questions concerning the transition of post-authorization procedures that just happened to IRIS. So basically from January 2025, so from earlier this month, all submissions that were sent on or after the 20th of December 2024 via the current systems for submission, so Gateway or PSUR repository, are managed in IRIS for the post-authorization procedures that you'll see listed below. So it's variations, Article 61.3 notifications, marketing authorization transfers, post-authorization measures, annual reassessment, referrals, post-authorization safety study, post-marketing surveillance studies, line extensions, and renewals. To the post-authorization procedures listed here, we have an exception, which is periodic safety update reports, which will transition a bit later to IRIS, with the procedure starting on 6th of February 2025 and onwards, as per PSUR timetable that is published on EMA website. And also companion diagnostics have different procedures and will stay in SIMED if they are received. So the purpose of this session is really to answer questions concerning the transition of these specific post-authorization procedures to IRIS. As some of you may know, we have planned also to transition further procedures on the pre-authorization side. But this is not the scope of this session. We are working on plans for the development of these procedures into IRIS, and they will be shared with you as soon as possible.
Katerina, sorry,
yes.
If you could go back to the slide, I wanted to add some clarifications on PSURs, as we keep receiving also some emails. For PSURs, it starts in IRIS for all PSURs with a PSUR procedure start date on the 6th of February. So we are also looking in those submissions which you made, for example, in December, for the procedures to be started on the 6th of February, and that means that it needs to follow already the IRIS procedure management model. So just to clarify that if the PSUR procedure start date as per timetable is 6th of February, then it goes to IRIS. Yeah, thank you.
Thank you, Simona. Okay, so we have already 12 questions, so let's start. Please provide a clear roadmap when MAAs will transition to MAA IRIS portal in 2026. So this is what I just mentioned. This year, as you are aware of, the IRIS team will work on the development of other procedures to IRIS, including MAAs. For now, what you can find on the website is a general plan for this. So on the network portfolio roadmap, but we are working on an updated version of a specific roadmap for the regulatory procedures transition to IRIS. And as said, we will share it with you as soon as possible. Simona, would you like to comment on that?
No, I think, yeah, this is what you said, as we will communicate once. Yeah, it's if it's updated, but on the website for the whole value stream, it's already there. Thanks.
Yeah, exactly. So it will be this quarter in any case. How do you link the ECTD sequence with the IRIS case?
Okay, thank you for the question. Is by the procedure number. So in ECTD, there is also the requirement to provide the procedure number, and then it's linked with procedure number in IRIS, case number in that case. Thank you.
What is the retention time of an IRIS case in the MA IRIS portal?
For the time being, there is no time set up, so it will be there for any historical also purposes or records. If it will change, it will be communicated.
Thank you. Please enable the technical functionality of downloading the full IRIS case from MA IRIS system. So I think this was raised also in other clinics, and this is something that it's already in our backlog, right, Simona? It was already taken.
Thank you. We are considering it as an additional requirement, and it will be discussed with the product owner and to see what are the functionalities, technical functionalities to fulfill this. Thank you.
Will IRIS be able to receive FHIR messages?
There is an integration on certain messages to be connected with IRIS. So just to get the information what is needed for IRIS cases to be created. So it will be considered as well.
Thank you. In the delivery file for PSUR submission, can we put the common safety email address, or even where shall we put a personal email address?
Yes, thank you for this question. As we communicated previously, so every contact for any procedure to be managed in IRIS needs to have an individual email address, which is linked to the access to IRIS contact point. So that means that PSUR submission, where you indicate the contact person for this PSUR procedure, needs to have the individual email address rather than the functional email address. I guess this is what you mean. So, and maybe some of you already are aware, I'm contacting those PSUR submissions, checking their contact email addresses where it has access to IRIS. If not, I'm asking companies to request this access to IRIS. And if they provide with a functional email address as well, to change it to individual email address, so that at the end, when we upload those all PSUR submissions into IRIS cases to be created, it needs to match the email addresses. Otherwise, the case cannot be created and it may delay the procedure. So just maybe also to summarize, first, in PSUR submission, you have to provide an individual email address. And if there is not registered an IRIS, so please request access to IRIS for this individual email address. And if your submission is already sent to EMA with functional email address, then you would need to raise a ServiceNow ticket asking to change the email address into the one that you requested to get access for your user. So those two email addresses in the PSUR and the IRIS needs to match. Thank you.
Thank you. Could you please confirm it is our understanding that day 5 will be managed outside of IRIS via UdraLink, and that day 25 upload of all final PI documents will need to occur in IRIS?
Yes, thank you for your question. It also was in last session, and maybe I confused with my answer, but just now to confirm, because in day 5, the communication is between the member states as well. You need to get their approvals and to get their comments. So that means that this communication continues via UdraLink, and only the final translations to be provided to EMA are uploaded to IRIS. So the communication between industry and member states, they continue as it is now via UdraLink, because after discussing with our business colleagues, sometimes it's very intensive communication, so it's only two sides to be involved, so it continues as it is now. And final translations to be provided to EMA follows the IRIS model, so you have to upload it via IRIS industry portal. Thank you.
Thank you. If the initial contact person is on annual leave when the procedure is first introduced in IRIS, it will not be possible to change the contact, which could be a problem in case of urgent validation issues, for example. How to handle that?
Yes, it's very important also question. So just it depends at which stage the contact person appears in the portal. So when we create the procedure, we are adding by default the product contact which we have on our system. So that means that this product contact we have on our system will be assigned by default as a portal contact. On the industry side, there is always the possibility to change the portal contact, logging into the industry portal and assigning another person. So then, you can anytime change the portal contact on the industry side. Any manager or any coordinator who is assigned to the organization can do it. So I guess that it answers your question and the change of the portal contact. And this is what it was done for those purposes, that if it is an annual leave or changes, that you can quickly change it to another person who will be receiving all the notifications from EMA and managing the case from the IRIS industry portal site.
Thank you. When a variation is submitted by Gateway and the variation case is created in IRIS by EMA, should the MAH do anything else in IRIS to consider the variation submitted, or is it supposed to be already submitted?
There is no additional actions for MAHs to be done via IRIS after the submission. So you submit via Gateway. It may take up to 72 hours, if I remember correctly, as advised by our registration team, for them to register the case in IRIS. And from then, once the portal contact is assigned for that case, you should be able to see the case, the portal contact should be able to see the case from the industry portal. And then the communication with the portal contact starts from IRIS. So just to answer, there is no additional action for you to process in regards to the submission of the variation. It's enough to submit as you are currently doing now and to wait for the case to appear on your system and to receive the notifications from IRIS system on this. Thank you.
Thank you. PSUR submission contact details. Would it be possible to include 2 or 3 individual email addresses?
For the submission, it's only one email address. But as I mentioned, on the industry portal, you can add managers or contributors or coordinators, as many as you wish. But from EMA side, we only have one email address. The system supports to have only one email address to be for all the communications to be sent on this procedure.
Thank you. Plan PSUR submission next week according to URD list. Please confirm if a PSUSA assessment report will be sent via IRIS.
If we are talking about this PSUR and the start date after the 6th of February, so that means that the case will be created in IRIS and managed in IRIS, and all the documentation will be sent via the IRIS portal. So yes, and if it is the question on the final assessment report, as we also informed, so the final assessment report will be available in the PSUR repository.
Thank you. Is it correct that for PSUR submission of a DCP product, we only have to submit via the submission gateway? Simplicity, and on the IRIS portal, it will be created by EMA?
Yes, so the submission process doesn't change. It remains as it used to be for all the types of procedures. And then after we receive a submission, EMA receives the submission, the cases will be created by EMA, indeed.
Thank you. Who did you say can change the submission contact? Is it not only the submission contact him herself who can do it?
If we are talking about the portal contact for IRIS case, then there are different roles who can change the submission contact. And I would advise you to contact the guidance on IRIS, available on IRIS website, with all the roles and who can do what. So actually the manager assigned to this procedure can change also the portal contact for one or another case.
Thank you.
Because the case can have more than one manager, but only one portal contact. So that means that from EMA side, we will have only one email address with whom we are communicating, but from industry side, you can have more than one manager assigned to the case who can monitor the case. I hope it's clear. So by default, assigning the portal contact, it becomes automatically the manager on the manager side, but you are also allowed to add as many managers as you want for one or another case.
Thank you. Can you kindly once again explain the cutoff date for PSURs? For example, if you have a deadline for a PSUR submission until 29th of January, should we manage it through IRIS as it is before 6th of February?
So yeah, the cutoff date for us is the start of the PSUR procedure. And if your submission deadline falls under the row as per published timetable, which is start date on the 6th of February. So that means those procedures will be in IRIS and all the other procedures onwards. Yeah. So for PSURs, our deadline is the start of the PSUR procedure. As you know, we have published the timetables on EMA website with all the rows with submission period by when the PSUR submission needs to happen in order for this procedure to start on one or another day. So this is the row with the start date of the 6th of February, then moves all the procedures into IRIS. I'll try to find, I don't know, Katerina, if you have direct link now too, I can try to find and to share it just to illustrate.
The PSUR timetable. Okay. Are all IRIS cases visible to all persons who have access to IRIS communications for the concerned company?
It depends on the role which you have. And I'm just trying to open the guidance document. Just bear with me, which explains. I will share my screen.
Yes.
So it's the IRIS guide on registration as well. And then on page 14, it talks about roles who can do what, yeah, who can see. So first, in order to see, you have to be assigned as a industry manager for the case. But if you are as industry coordinator, and users with those roles can access any submissions applications made on behalf of an organization. So actually the coordinator can see all the cases created which belongs to that organization. So this is the user, and managers and contributors can see only the cases for which they have this role assigned, specific cases only. So I guess it answers the question.
Thank you. Okay, so next question. Please specify whether all products under national procedures or a decentralized procedure will be managed through the IRIS platform.
Maybe to clarify here, IRIS platform manages the procedures. So if the procedure is managed and as a reference authority is EMA, and includes the DCPs or MRPs or national approved products, which may be work sharing procedures with CAPs and NAPs, PSURs, PSUSAs, referrals. So that means that those procedures will be managed via IRIS portal, and the information will include all those products which are part of that procedure. So I guess it answers the question. All the national procedures, they are remaining as it is now, either in different member states or through the MRP DCP procedure, etc. So it doesn't change. But those procedures where the reference authority is EMA, where now the EMA is managing and includes all types of products, then it will be via IRIS.
Thank you. Could you please confirm who is the submission contact for centralized procedures? Is it confirmed it is the contact mentioned in the EAF submitted for initial MAA, and it is not possible to change it by stating a new contact in each EAF?
Yes, by default, it is a product contact held on EMA database and as advised by you in this electronic application form submitted after the initial marketing authorization. In case if you need to change it, there is a procedure, and this information is also provided in a guidance document. You need to log a ticket and to provide with the attachment document to change the product contact. And also, if you want to keep this product contact for all post-authorization procedures. But as I said, it will be by default assigned to any new cases to be created, and then you have again freedom to change the portal contact or to add the managers for this specific procedure. So this is what gives you a freedom, and you then do not need to notify EMA every time if the portal contact or communication contact from EMA is changing. So then it's up to you to change it as you wish, but we want to have it in our system, confirmed product contact, which can be used for all post-authorization procedures as a default contact. And this is what is, I guess this role is meant when we are indicating it in the electronic application form. But as you may wish to change it, so you can do it through the portal contact without any additional communication to EMA.
Thank you. When the company updates the contact person of a procedure during the procedures, will the new contact person receive all emails immediately, or is there a delay, or will only the original contact receive the emails?
When we did testing as well, it's just like a matter of minutes. When you update the portal contact from your site on IRIS Industry portal, it's very quickly appearing on our site, and all the emails then to be sent after this update will go already to the new portal contact. So it shouldn't be an issue. It's not a day or longer. It's just really very short period of time when this change is reflected in our internal system.
Can you please confirm that for PLM submissions such as PAMs and annual reports, there is no additional action in IRIS for marketing authorization holders? They are submitted by the gateway but no upload to the IRIS platform.
Yes, for the time being, the submission for all the procedures, which are now to be managed through the IRIS, remains as it is.
Thank you. When a PSUR is submitted by a CESP, should MAH do anything else in IRIS to consider the PSUR as created as a case in IRIS?
The most important thing for you is to ensure that the submission contact which you indicate in PSUR submission has access to IRIS, is registered to IRIS, and it is an individual email address. If it, as I said, if it matches the PSUR submission with the information that we are having in IRIS, then the case will be automatically created and you will be able to see it on your industry portal. There is no additional action. But if those portal contacts are not registered, so then you may receive our email with actions you need to proceed. So just to register the contact and to request the change for PSUR contact. But if the email addresses matches, there is no additional action for you to do it after the submission through the PSUR.
Thank you. When a variation is created in IRIS, when we look for the case in IRIS, in submission details, there is a submit button in the bottom of the page. What is the purpose of that button if the variation is already submitted by Gateway?
Okay, so as you know, there are other procedures which are already in IRIS, were actually moved into IRIS before us, and it has an option to create the submissions from IRIS directly. So this could be for those types of procedures to be submitted through the IRIS portal as scientific advice, orphan procedures, and you are aware about them as well. But for variations, the submit button can be used when you want to withdraw the procedure. So actually, then you are updating this information, you are providing this information through the IRIS portal when you want to withdraw the whole procedure, but not the one scope. So this is why you can use this button. And I will try now to maybe to share on my screen as well, just to demonstrate you. This is a UAT environment, so the data is randomly allocated. And if I'll go to the one of the procedures, maybe PSUR is not the good case because there is no option to just bear with me. I'll try to find variation type 2, for example. Yes, and this is why we have a submission details tab. Once I clicked on the case number, it opens you this window, and it has submission details, and it has also withdraw submissions. So we also explained how to withdraw one or another submission, and that you need to provide the withdrawal reasons also in this form. And most likely, this is why you put the submit button when you want to withdraw the whole application. So this is where the submit button can be used, but not to create the submissions. I hope it's clear. I'll stop sharing my screen.
Thank you. It is our understanding that the cutoff date for case management in IRIS is 20 December 2024. Are you planning to transition in the future any ongoing procedures started prior to a cutoff day, or will all procedures be finalized outside IRIS?
For the time being, there is no plan to move the ongoing procedures into IRIS, so they are to be finalized as per current systems.
Okay.
Thank you.
Thank you. To be sure I understood, for already submitted PSURs in 2024, it was confirmed last time that var, and var will be still sent to generic email address if it was used for initial submission. Can you confirm?
So this is, we need to think about the start date of the procedure. If the procedures were submitted for PSURs in 2024, where the start date of that procedure is in February, which has happened also because I've seen submissions made in December for the procedures to be started in February. So that means that I send the emails to those industry contacts asking them to change the email address. But if you submitted it in 2024 for the PSUR procedure to be started before the 6th of February as per timetable, then we do not really communicate it, and the procedure will be still managed as per old way. So this is where we need to pay attention not on the submission date, but on the start date of a procedure. If your PSUR procedure needs to be started on the 6th of February, then we are talking about IRIS way of managing the procedures. I think I need to try to find the, if you have opened the timetables for the PSURs, I quickly try to find it. Just maybe we can go to another question as well.
Okay. Yeah, this next one is about the roadmap, but just to restate that we will share an updated version soon this quarter. Centralized procedure, PALM, we received our first case. Submission contact got notification but is not able to see content. Our coordinator sees content but not able to assign other managers. Shall we wait for a few days or contact directly the service desk?
A submission contact got notification but not able to see content. So I would say, so first, if you could ensure that your submission contact received notification from IRIS, I guess. So that means he's been added as a portal contact on our site. And just to ensure that he got access to IRIS. So this is how he could see this this case created. So, or to clarify all those aspects, please raise a service desk ticket and try to provide as many details as possible. Because if you say my colleague cannot see, and we need really to be clear what is your colleague, what role she has. Does she has as coordinator or industry? There is also industry administrator who assigns all those different roles. So please provide as many details as possible. Then it's easier, to find the root cause of one or another issue. But if a submission contact is our product contact in our system and he's registered with access to IRIS, so in normal behavior of a system, he will receive the email notification on that case, and he should be able to see the case once he's logged in on the portal.
Thank you. I'm a QPPV, but another member of my company is registered as administrator. Is this a problem?
It can be a problem if you intend to be a contact for one or another procedure and you don't have access to IRIS. So let's say the general rule is if any role which are appearing under the product contact needs to be contacted, email sent, received, or to manage the procedures from the IRIS portal, that means that this role needs to request access to IRIS. Otherwise, you will not be able to see or receive any communication on IRIS. So it's just think like this. We have a table of product contacts which have different roles from the industry. So that means that in one or another case, they are to be communicated in different types of procedures. So in order for us to issue the communication via email or for you to be able to view the case, you need to have certain roles in IRIS to be requested. So if as administrator is registered as an administrator, but the administrator role, I'm just trying to open the guide as well. So administrator can only assign other roles. They do not see the cases. They cannot do they cannot manage the cases at all. This role is created that we could monitor from the industry side who needs access to IRIS and to remove those access if the access is not required anymore. So just also please read the guidance carefully with all those different roles, because only the manager can see and manage the cases. But if it doesn't answer our default rules, this person being assigned into IRIS as a manager, as I said, that automatically and by default, we assign the product contact, which is indicated in the electronic application form for all post-authorization procedures, if it is a variation, but if it is with PSURs, then we look in the submission contact. So as I said, yeah, those two portal contacts need to match what we have in IRIS and what has access into IRIS. But yeah, I would really advise also to consult this guide as it's explain all those roles in more clear way.
Thank you. Can the company IRIS high-level administrator see all cases and change the manager of a case when required?
I will again maybe put on screen the guidance when we say administrator, because maybe the role administrator within your organization is completely different what we call administrator in IRIS, yeah? So for us, the IRIS industry user administrator, as I said, can only assign other roles to those who request for organization. They do not, they cannot access IRIS themselves. So it also depends. So from IRIS perspective, any of your colleagues from your organization needs to have one of those rules as described in the guidance in order to perform one or another action.
Next question. Can the industry manager and coordinator change the default portal contact for any procedure?
Yes. Industry manager can change just one thing. Yeah, the manager can change the rule for portal contact.
Okay, thank you. Please confirm if a notification email that SUSE assessment report is available in IRIS is sent by email. Is it sent only to one email address, or is it possible to send to multiple addresses?
Is sent by email? Yes, it will be sent by email from IRIS system to the portal contact as we hold on the case to one email address. It's only one email address. The portal contact only has one email address.
Okay, thank you. If I am a QBPV, then I should request an IRIS coordinator role in order to have access to all products related to my organization.
In this question answer session, we talk about the procedures role. So actually, if you are foreseen that it might be any procedures upcoming, which will be to be managed by IRIS, and you have to be involved in those procedures and to see the cases, to manage the cases, then you should request the access to IRIS role before those procedures are to be created in IRIS.
Thank you. In addition, can generic email addresses in EudraVigilance remain generic even if IRIS refer to personalized email addresses?
It depends, if, for example, for PSUR submissions, the submissions is happening through another system, but this PSUR submission email address is used for IRIS. And IRIS has a rule that we need to have an individual email address. So then it answers to a question that those addresses need to remain the same and to match it. So I cannot answer to this because it would be good to know for which reason this email address is to be used, which is holding Udra vigilance. If it is for procedures to be and for communication to be held outside the IRIS system, then it should follow the rules as for this procedure to be run, or whatever you have to do it using this email address for your Udra vigilance. But when it needs to be used in IRIS, when it needs to be remain the individual email address. But as we advised, it's also good to align those email addresses because, as you understand, it's linked with access to EMA. So, and even those rules to be put in IRIS, it needs to answer our security safety requirements. And from EMA, we want to align the user with one email address, but at the end, the EMA ensures with whom and to which email address we are communicating on different types of procedures and which users are accessing EMA applications. So yeah. If it has a link with IRIS, it always needs to be individual email address, but you can set up out-of-forward rules as per our presentations, which are also available. So you know that the emails are coming from a certain email address from IRIS, which helps you to set up a out-of-forward rules, and it always has the IRIS token in the email. So yeah, there are some kind of indications which could help you to set up out-of-forwarded rules for all the emails received from IRIS system.
Thank you. As referrals for centralized procedure, NAP will go to QPPV. Will they receive an email?
If this question relates to the email when the procedure is created in IRIS and those persons are assigned as a portal contact, so indeed they will receive the emails and all the notifications which are supposed to be sent for one or another procedure, so from IRIS. But this is again, this QPPV person needs to be registered in IRIS, has an access in IRIS. And if this person is indicated in the referral submissions as a contact point for one or another procedure, so then this communication will be sent to those persons.
Okay, thank you. The issue is that the managers will not yet be added once a new procedure is created in IRIS. So if the contact person is out of office when a new procedure is created, we are stuck.
Then I would advise that if you are having this case already, so please raise a service desk ticket. I'm just, the product contact is assigned automatically, then it's portal contact, but let me go again with, again to the coordinator to read. Okay, I will come back to colleagues because it's not in the guidance, but I've got the feeling that industry coordinator can also assign a managers, but I will confirm in a minute, yeah?
Okay. Okay, for now, let's focus on another question. For communications between EMA-PL and applicant, especially close to the opinion date we request to submit a final PI, this is my understanding that these communications will continue via Udra link. Is this correct?
No. Everything, all communication, if the case is created in IRIS, is going to be via IRIS portal. So that's why the IRIS portal allows you to add the documents which you are currently changing with EMA through the Udra link. So all the communication during the procedure with EMA and industry needs to happen via IRIS. So if it is an email to be sent, so you are follow up on those emails which you received from EMA, because it is very important to keep the IRIS token in this email, that it correctly lands to the specific case. And if you need to exchange any documents, so you upload those documents directly from the IRIS industry portal, and EMA can see those documents and receives automatically generated notification that there is some new documents uploaded for this and that procedure. So yeah, the communication between EMA and applicant are to be accordingly to the IRIS model.
Thank you. For the question about before, do you have that update about the managers?
No, not yet, Katerina. I'm trying to find it.
No problem. Yeah. Okay. I'm repeating the backlog. How long does it take until PSUSA procedures are visible in IRIS?
PSUSA procedures are visible in IRIS. Okay, just there is our internal process that those procedures will be created in bulk after the submission deadline. So as you know, all the PSUSA procedures, we have their submission deadline. So EMA waits until we receive nearly all those procedures following the submission deadline. After the submission deadline, the file will be generated for all submissions, and then it will come to IRIS for case creation. So actually, you should expect to see the case if, as I said, it's aligned with our rules for portal contact and they are successfully created. So after the submission deadline and just between this period after the submission deadline and prior to the start of a procedure. So please allow us some time also to create those procedures. And if those portal contacts, because this is for us, it's really crucial that those portal contacts have access to IRIS, otherwise we cannot create the case and this may delay the procedure, as I mentioned before, then we will have to communicate directly with those companies asking to correct this data in order for those procedures to be created. But it's also, it will happen between the period after the deadline for submission and before the start date. The cases should appear on your portal.
Okay, thank you. For NAPS, individual inboxes need to be assigned. What does individual inbox mean? The personal email address, I think, yes, right?
Yes, so it's a personal email addresses, not functional. For example, you can have a email address pharmacovigilance at company name. So this is what we consider as functional or generic email address, but it needs to have a individual email address linked to that particular user on the system. Even when you are registered to get access through the IAM, the users are registered with their individual email addresses. So it needs to be actually the same email address as well. Yeah. But, the same user got the same credentials from the start of the entering to the EMA system. So first registering via IAM, you provide your email address as a user and this email address to be used for any accesses to the systems or communication to the systems. It's a bit of change on the way of communication with EMA and user access to different applications.
Thank you. It is not totally clear the impacts for MAHs of MRP, DCP, NAP. Will it be possible to publish a scheme or flow showing how and when such type of registrations are impacted and must be handled in IRIS?
I think we can think about something, Katerina, but just, don't really overthink about it. It's just from the perspective as it is now, If your CAP-NAP includes in the procedure to be managed by EMA, just regardless of the systems we use, and you are receiving the communication on those procedures, which might be PSURs, MAGs, so it will continue as it is, but then those procedures are moved into IRIS. So that means that you will receive a communication from the IRIS. So just if the MRP, DCP, or NAP product is part of the procedure to be managed by EMA, as it is now, so you will receive all the communication then from the IRIS system. But we can also think about how to make it more clear. So this is where the products are included to the procedure to be where EMA acts as a reference authority, which are referrals, work sharings with gaps and naps. But for work sharing procedures, we have a lead product assigned. And actually for those, the portal contact will be one only, which is indicated as a lead product. So those products will be part of a procedure, but there is no impact for the NAP products contact points. And because now you also do not receive the communication separately, only the person who is indicated for the lead product receives this communication, so it remains as it is now. But if a procedure currently now, again, I'm talking, let's see, not in IRIS, but as currently in other systems, for example, referrals or PSURs, where EMA communicates to each and individual submission contact per product. So this remains the same approach in IRIS. So that means that for those procedures, the product contact for MRP, DCP, and NAPs will receive a communication and will need to have access into the IRIS system. But yeah, let's try to make it as much clear as possible.
Okay, thank you. For procedures which are already ongoing and an IRIS case is not yet available, will the LRP Day 25 submission still continue via UDRA-link?
Those procedures which are not to be managed in IRIS yet, so they all ongoing procedures, so they will continue as it is now. Nothing changes. Here we are talking about the procedures where the submission, they are submitted, the original submission, not the responses to list of questions, but we are talking about new applications, are submitted on the 20th of December or afterwards, and for PSURs with a start date on the 6th of February. So don't be confused. Those procedures which are already started in other systems, all the process continues as it is now.
Thank you. Meanwhile, just want to announce I have launched the feedback survey on this session, so please leave your feedback there. It would be really appreciated. It's just a rating question to let us know how useful it was. And then we also have an open question in case you have any other suggestion to leave that you would like to leave in writing. Thank you. It's still on Slido feedback survey, by the way. Could you please explain how the contact email for a PSUR of a non-CAP, which is provided in the delivery file, can be changed?
Via ServiceNow ticket. Please raise a ServiceNow ticket and indicate, that for PSUR submissions, you need to change the email contact from to and for which PSUR submissions. Then it's easily, and I'm also, monitoring these as well. So just, raise a ServiceNow ticket.
Thank you. Do you still receive emails each time the status of a specific procedure changes?
Are you asking, do we as EMA receiving? But I guess you mean industry contacts, I guess. So it depends. You receive the same notifications as you are receiving now for the major milestones of the procedure. So when the case is created, you receive the email. For the start of a procedure, you also will receive an email. If there is any validation issues, the communication will be sent to IRIS for you also to solve those issues. for the updated assessment report, you also receive email. So actually, it's not that the system is silent and you need always to go and check on the system what is going on. No, you will still receive active notifications for the major milestones of the procedure. So that's why the portal contact, keep repeating, it's very important, yeah, to have the correct portal contact. And if he goes to the holidays, please change the portal contact. And yeah, if you want that the communication lands to the person who is at that moment dealing with this procedure. So I guess, yeah, it answers the question.
Thank you. For the RRP Day 25 submission, can we upload the language files as zip folder if it does not exceed 50 MB?
Yes, you can upload. I think we consulted in the guidance document. There is information on the general size of the folder, so it shouldn't be a problem.
Okay. Then concerning the plans, as we said, we will share updated plans by the end of the quarter, so soon. In regards with work sharing, including NAPs, is it correct that only every procedure numbers is to be included in the EAF, or also this procedure number will be assigned for the work sharing?
In the electronic, yes. So for the work shares, the case is created following the receipt of letter of intent. So you inform the MA with the letter of intent, then the case, kind of draft case, is created in the system, and you've been provided with a case number to be used for all the submissions and further communication on this. So only has to be included in the, yeah, this is what it is like, the reference for the procedure.
Thank you. When the amended guideline on variation 1704/2024 will be cleared on EMA website?
I would advise, this is on variation guidelines, so I guess you mean on business process as such. So I'd advise to raise a service desk ticket for our business colleagues to capture it.
Okay. Are potential shortage notifications to be submitted on IRIS as well?
Yeah, shortages are not in scope of this presentation. Here we cover all the questions related to the post-authorization procedures. So I would advise you, if you have this question, to raise it via service desk ticket.
Okay, we can take the last question. If I use a generic email for initial PSUR submission in 2024, PAR was submitted this week as well with generic email in delivery file. Do I receive the FAR after 6th of February to this generic email?
It's just when your procedure for which email you expect are to be started. If it is to be started on the 6th of February, then either you already received an email from me or you will get the email from me asking to change the email address. But if your procedure to be started before the 6th of February, so nothing changes, you can be reassured that you will receive a communication because it's still to be dealt in old systems and using the old way of communication.
Okay. Okay, so our time is over for today. So we will reply in writing to the remaining questions. So the Slido will stay open for 1 week. Please check it out and to see the updated replies there. We will as well update the frequently asked question document with the most frequent questions that we collected in this Q&A clinic and also in the Q&A clinic from last week. And then we will assess in the next weeks, also according to the requests we receive via service desk, if it's needed to have an additional Q&A session. And we will, of course, notify you via the usual relevant channels when the FAQ document is updated. And just a reminder that we will also share an updated roadmap in the coming weeks. Simone, I leave over to you for closing and any final remarks. Thank you.
Yes, just maybe because it was one question on the translation, so just maybe to reiterate. If the communication are to be between the member states and industry, it continues through the usual. And when you need to submit the final translations, then it goes to IRIS, because I've seen it twice as question, so it's important. And yeah, and as I said, as Katerina said, we will do our best to publish the questions as soon as possible and to answer those in writing which were still to be answered. Thank you very much for your participation.
Thank you.